Hello everyone, and welcome to the second video in a 4-part series of short webinars for the Minnesota Health Literacy Partnership's 2022 Health Literacy Month campaign. In the previous video, we reviewed how the term health literacy has been defined since it first appeared in 1974. We also discussed why health literacy continues to be an important topic today, including reasons for ongoing low health literacy and the negative impacts of low health literacy at the individual and community levels. Now we'll turn our attention to the teach-back method, which was developed as a technique to improve patients' understanding of medical information in healthcare settings. In this webinar, we'll first discuss what the teach-back method is, followed by a review of when the teach-back method was developed. Next, we'll look at the effectiveness of the teach-back method over the past 2 decades, and then conclude the webinar with a discussion of a relatively new sister technique known as check-back. So, what is the teach-back method? The teach-back method is a way to check a patient's understanding of medical information. For example, during a medical appointment, a doctor could use the teach-back method by asking their patient the question, quote, "In your own words, could you please tell me what we've talked about today?" If a patient can correctly teach back health information to their healthcare provider, then the teach-back method was used successfully. A key part of the teach-back method is the use of plain language when a healthcare provider is communicating with their patient. If a provider uses highly scientific or medical or technical words when explaining health information to a patient, the patient will likely have a difficult time repeating and explaining these words back to the provider. Teach-back emphasizes the responsibility of healthcare providers to communicate clearly and to also make sure that what they say is understandable to the patient. In short, the teach-back method holds healthcare providers accountable for the way they explain health information to their patients. The teach-back method is also known by other names, such as show me, chunk and check, and closing the loop. At this point, you may be wondering when the teach-back method was developed and what prompted this technique to be developed in the first place. The origins of the teach-back method date back to the early 2000s, when several studies were published on healthcare communication and teaching techniques. In 2003, Dr. Dean Schillinger, an internationally recognized health communication expert, published findings from a study that examined how often doctors treating patients with diabetes checked to understand their patients' understanding of health information. Schillinger's study found that the doctors in the study rarely checked for patient understanding and described this as a, quote, missed opportunity that may have important clinical implications. 1 year later, the Institute of Medicine Committee on Health Literacy published a report titled Health Literacy, a Prescription to End Confusion. In the report, the authors explain why patients might be reluctant to ask their providers to repeat health information more clearly. I've included an excerpt from this report on the next slide, which I'll get to in a moment. The report recommends teaching techniques to promote a health-literate society. The term teach-back appears once in the report, in a section that calls out researchers at the University of North Carolina who developed teaching techniques to overcome literacy-related barriers to care. Lastly, on this slide, a study conducted by DeWalt et al. In 2010 documented the development and use of the Health Literacy Universal Precautions Toolkit. It's worth noting that teach-back was included in this toolkit. Before we move to the next slide, I want to quickly note that this is by no means a comprehensive list of the pioneering research on teach-back techniques. This list simply serves to highlight a few major developments in the early days of Teachback. As I previously mentioned, this is an excerpt from the Institute of Medicine's 2004 report on health literacy. I won't read the entire excerpt, but I do want to draw your attention to the final sentence shown here, which says, "If health professionals were able to take the time to ask their patients to explain exactly what they understand about their diagnoses, instructions, and bottle labels, the caregivers would find many gaps in knowledge, difficulties in understanding, and misinterpretations." This compelling statement underscores the importance of the Teachback method. Although it was written almost 20 years ago, the Institute of Medicine's report makes a case for Teachback that is still relevant to healthcare settings today. Current research supports the continued use of the Teachback method in healthcare settings. This is because many patients, and according to some studies, a majority of patients, remain confused about their health information and healthcare plans following health appointments and hospital stays. While the Teachback method has been shown to be an effective tool, physicians typically have very limited interaction time with their patients, which may lead to physicians either forgetting to use the Teachback method or deciding against using it due to lack of time. In light of this issue, a sister technique has emerged that shifts the checking of health information from the healthcare provider to the patient. The checkback method expands on the Teachback method by focusing on what the patient, rather than the healthcare provider, can do to check understanding of health information. Checkback is especially important when considering that some physicians may forget or forgo using Teachback. With Checkback, the patient plays a proactive role that helps them get the most out of their limited time with a healthcare professional. Communication was a central theme to this webinar, and it certainly will be in the next one too. We'll be discussing the use of plain language in healthcare, a key practice that can help bridge gaps in health literacy and promote widespread understanding of health information.